Senator from Nevada is recognized.
Mr. President, this huge stack of paper that I have on my desk, people may be wondering what that is. Well, over 2,000 pages of these papers represent the actual health care bill. The rest of it is the regulations that have been written just to this point. From what we understand, once the whole health care bill and regulations are written, this stack will go much, much higher. Estimates are as much as 20,000 pages total. The complexity is incredible in this. And the resolution that we have before us today are part of those regulations that many of us believe are going to do damage to our health care system. So I want to talk a little bit about just the regulations proposed today. Over the last month or couple of months, I've gone around to businesses in my home state of Nevada, talking about many of these regulations as well as the health care bill. And let me tell you, Mr. President, many small business owners in my state are very concerned about what this bill is going to do to their business. A lot of small businesses struggle to do the right thing by giving their employees health care. A lot of them can't afford the Cadillac plans that a lot of big businesses have, but they're trying to do the right thing. Some of them cover half of what their employees, they pay for 50% of their health care bill. Some of them have really slimmed down plans. The vast majority of the plans that small businesses have would not meet the minimum standards that this health care bill is going to require. Why is that important? Well, the president said during this whole health care debate that if you like your plan, you can keep it. If you like your doctor, you like your plan, you will absolutely be able to keep it. Well, there's a small detail that he left out of there. The detail is this, that if you change your plan, and it doesn't have to be in a significant way, if you change your copays, you lose your grandfather status. And if you lose your grandfather status, you now have to comply with the minimum standards in the federal law. That's a problem because most small businesses, it will dramatically increase the cost of their health insurance for their employees. And a lot of them are barely keeping their doors open today. So a lot of small businesses that I've talked to are actually putting pencil to paper and figuring out whether they're even going to be able to keep their plans that they have today. Well, you know, the advocates will say, well, don't change your plan. Well, the reality is every single year, businesses look at their health care plan, and almost every single year, they make changes to their health care plan. Under this bill, you make changes to your health care plan, you lose the grandfather status. And that's a major, major, problem. And that's why, according to the government's own statistics, by 2013, as many as almost 70% of all employer plans and 80% of small business plans will relinquish their grandfather status. That's the government's own statistics. Well, that doesn't sound like everybody's going to be able to keep their plan that the president talked about in his promises about this health care legislation. Now, in my view, and I think that this view is shared by a lot of experts who are studying this plan, and we're seeing this recently, that this bill is going to raise the cost for those who currently have insurance. I mean, you think about it, if you're going to cover 30 million people, there was a $500 billion cut in Medicare, we know that. There's increases in taxes, we know that. A lot of different taxes were increased to pay for this bill. But the other pay for in this bill that wasn't officially scored as a pay for is people who have insurance, it's going to become more expensive because of a lot of the mandates in the bill. We've seen recently insurance company after insurance company, when they're bringing to their state commissioners, they're bringing forward fairly large increases. I was talking to a small business owner the other day in Nevada, told me that his plan is going up 38%. That was the lowest bid he could get, was a 38% increase for this year. And the insurance companies told him, it's because of this health care bill. Well, I was on a telephone call yesterday, did a telephone town hall meeting back in my state, and a senior citizen was on the phone. He was telling me about his Medicare supplemental insurance that is covered by his union. The co-pays and the premiums for that were going up dramatically, and he was wondering how he was going to be able to pay his rent. He has virtually no discretionary income, so any increase is going to make it tough. He's actually figuring out how he's going to be able to make his rent payments. Those are some of the unintended consequences with this bill and with the regulations that are being written. So, Mr. President, I think that we need to take a second look. First of all, obviously, I would like to see this bill repealed and replaced with real health insurance reform that makes insurance more affordable. Things like buying insurance across state lines, being able to buy health insurance across state lines like we buy car insurance across state lines. I'd like to see us enact real medical liability reform that would lower the cost of health care in this country. All those kinds of things could be good to make health insurance more affordable, more accessible for more Americans versus what we have before us today. But let's at least start by rejecting the regulations that are going to hurt the grandfathering status of a lot of these plans that we have. Because if you take away the grandfather status for a lot of the plans, a lot of small business people are going to be hurt, and a lot of people who work for small businesses are going to lose their health insurance because the small businesses won't be able to afford to comply with the new regulations and the new cost of the regulations that are in this health care bill and the regulations that are associated with it. So, Mr. President, I would urge support. I appreciate Senator Inslee for bringing this resolution of disapproval of these regulations forward. I think it's something that this whole United States Senate should support, and support in a bipartisan way. Mr. President, I yield the floor.
Who yields time?